when I first started this journey, I would say every single kid with a visual impairment needs a cane. I've kind of backed off that just a little bit. There are times when a white cane isn't going to serve the purpose. For a student who is blind, no vision, 100% a cane needs to be in their hand. If they have zero vision, there's no other way to preview your environment, or unless you have a guide dog, right? So we need a ground tool. We need a tool for ground preview, surface preview. There are kids, some kids who use a walker, right? Sometimes that walker serves as your ground preview. Grace Ambrose has developed what's called the pediatric belted cane, a cane that is wearable. So it has a belt and it's shaped like a rectangle, and it attaches to this belt, and the kids just walk, right? And the cane is attached to them. They're getting information through their torso. That's for kids who are under 5. For a little one who can't hold the cane, or who has the inability to hold a cane, or who has such great sensory issues that they just refuse to hold anything, that belted cane is an amazing tool. They don't make it for anybody bigger, so that's sad. For kids who have some behaviors, who throw things or hit, a cane isn't appropriate in that moment because they are still trying to learn, right, how to manage their own self. And using a cane would either increase behaviors or not serve a purpose. And so serving a purpose is the intention of that cane. But we also have to teach that this cane is a tool that gives us information. So putting a cane in somebody's hand isn't the end result. Having them understand that when I find a curb and my cane tip goes down, that means in 2 steps, my feet are going to do the same thing. So we need to have the cognitive ability to not only understand that my cane tip has gone off the end, but that my feet are going to go off the end too. So we have to be able to make the connection of, yes, I have information, but even greater, I have to respond to this information. And so there are times when our kids aren't ready for that. We're only working on figuring out how to get from point A to point B, and they have a person that's going to monitor their safety, and their goal is to complete this route. So in those instances, I don't recommend a cane. Eventually, I want them to have a cane, but in that moment, I would not recommend it.